Hey everybody, this is Dr. Lyell here at Proactive Chiropractic in Jacksonville, Illinois. Today we're going to do a quick take on a technique that we do in our office that you're just not going to find anywhere else in this region. I believe we're the only office in West Central Illinois that offers this tool. The closest office is going to be about 40 minutes away in Springfield or down in St. Louis. So the technique that we're doing, or that I'm certified in, is something called Graston. And it uses a series of different instruments to work on breaking up scar tissue or adhesions in your muscles. And so quickly, let's talk about what scar tissue and adhesions are and why that's important to you and the pain that you're suffering from. So when you're born, your muscle tissue is nice and clean and parallel fibers, meaning the muscles can contract and stretch without any sort of interference or adhesions causing restriction in your muscles, and those restrictions would cause pain, of course. As we get older, this nice smooth muscle tissue, and this is a very crude example, so don't laugh at me, but this crude example will make a lot of sense in a second. When you get injured, if you sprain your ankle, you go skiing and you fall and hurt yourself, you break a limb, that muscle tissue that was once smooth and parallel now starts to have rough and bumpy spots. Those rough and bumpy spots are scar tissue, basically. Your body is going to lay down scar tissue or adhesions after an injury, and that tissue is never 100% right. So what we do is we take one of these tools, depending on the area of your body, we'll pick the correct tool for the condition. We take this tool and we're going to go in there and we're going to break down. We're going to get in here and kind of bust up these adhesions or scar tissue, however you want to call it. And you may be wondering, what is scar tissue and adhesions? If you ever had a massage or your spouse is rubbing on your neck and they're like, oh, you got a big knot in your shoulder. Well, that's scar tissue, okay? That's adhesions. And so we go in there and we break all that up with this tool. And kind of think of it like a very focused deep tissue massage. Then we're gonna go in and stretch that tissue out. And we're gonna try to get as many of those little wrinkles and bumps out of your muscle tissue. It'll never get back to 100% where it should be, but by getting the majority of it out, 90-something% of that scar tissue out of there and gone, and then re-lengthening that muscle, we're able to significantly reduce pain and start the road to permanent recovery. Because we can sit there and stretch you out, you can do home exercises, but the problems don't always 100% go away unless you've addressed the scar tissue in your muscle. Then after we've done that type of work with you and we give you home exercises to keep it from getting tight again, we also then take something called kinesiology tape. Okay, kinesiology tape you may have seen before on NFL football players, baseball players, in the Olympics. It's a very simple, non-drug, there's no chemical in this stuff here. It's a very simple way to support your muscle tissue and joints after you've had treatment. And so typically, let's say somebody has really bad posture. They sit at a computer all day. What your body will do over time is adapt to that posture. So whatever position you're in the most, your body's going to basically form to that over time. That's where we see people over the years start getting into this position here with degeneration of their neck. Their muscles get tight here. They have weakness in their upper back. We had a video on upper cross syndrome a few weeks back, and if you're interested in learning more, go check that video out. But when you get into this posture for years and years, your body basically is now stuck in this position. You can get adjusted 100 times, but if you don't get the posture corrected through the musculature, you're going to continue to have headaches, neck pain, shoulder pain. So what we go in and do is we adjust you, of course. Then we go in and break up those real tight muscle tissues through this technique and another one that I do called active release technique. And then we tape your shoulders back in a position to help you stay in that posture while we retrain you through home exercise. So it's a kind of a three-part process. You loosen up the muscle tissue, you retrain the muscle tissue, and you get the spine back in alignment to really reduce pain and then keep the pain gone. We want to talk real quick about headaches as part of that. So when you're in like a really bad body position and your head's forward, it starts pulling on this upper muscles up here. And these little X's on this chart here replicate pain patterns, okay? There's a concept called referred pain. Many of my patients will come in, they're hurting in their neck, it's going down their shoulder, or it's into their upper back. And just by simply using one of these tools to come in here and break up that adhesion or that knot, and then stretching that out makes a gigantic difference. I've had patients who've had years of pain, have gone 5 or 6 different providers, and 2 visits with this, they're on the road to recovery. Okay, so I just want you to know that our office is providing this technique on most of our treatment plans. We do a very thorough exam on our first visit, and based on that, we'll determine if you're a candidate for this kind of care. But most patients are, and they get tremendous results with this, getting you out of pain quickly, and then we work to keep it that way and teach you how to prevent it from coming back. So if you are interested in the Graston technique, the kinesiology taping, please give us a call or send us a message on Facebook, and we'd love to see you in our office. Thank you very much, and have a great day.